Today, we are going to spend some time looking at COVID-19, really the post-COVID syndrome. And there are some studies suggesting that at least 50% of people may have some form of post-COVID syndrome. So some of the references are in my book, Max Your Immunity, which honestly I was never planning on writing, but sitting at home waiting on COVID to resolve, ended up writing this book. The rest of the references are on the slides. We could spend the whole hour going over this slide itself, looking at symptoms, the pathophysiology, the treatments, and the risk factors. But I'm really going to be explaining a lot of this as we go along. I do include this fabulous slide, however, so that you can look at everything in its entirety. Because if you look at the bottom, long-haul COVID or post-COVID syndrome, you have long-term tissue damage, cardiology-wise, pulmonary-wise, neurologically, and unresolved inflammation does become a big issue. So with viral persistence and lymphopenia, gut dysbiosis, and autoimmunity, we're seeing more and more autoimmunity as time goes on. And there's the reference to that slide. So the pandemic of the coronavirus disease has provoked a secondary pandemic that we now call long haulers. And the authors of the study that is listed here propose that to determine the presence of post-COVID symptoms, the symptoms should appear after the diagnosis of SARS-CoV-2 infection. However, the situation has some problems due to not only all people infected by SARS-CoV-2 are literally diagnosed with the disease. So some people have a mild form, they're not even aware that they're ill. Based on the relapsing, remitting nature of post-COVID symptoms, the following integrative classification has now been proposed. So potentially infected-related symptoms occur 4 to 5 weeks after people have COVID. Acute post-COVID symptoms from week 5 to 12. Long haul is supposedly starting at week 12 to 24, and persistent post-COVID symptoms are more than 24 weeks. These are the signs and symptoms of post-COVID syndrome. As you can see, when you go through these, they really are a myriad of things that you actually see when people have COVID itself, all the way from fatigue to sleeping disturbances and cough and hair loss. But we do see dysbiosis. So it's really hard to improve the patient's immune system if their gut is not healthy. We are seeing more cardiomyopathies and related cardiovascular issues, including palpitation. And then probably the worst of all of this is not brain fog, which is common, but is actually Pott's disease. And there's the references related to that. The study listed here suggests that 80% of the patients that were infected with SARS-CoV-2 developed one or more long-term symptoms. So this study suggests that it's even more than 50%. So it's important to look at what happens in the patient. And the plethora of symptoms affecting multiple systems exhibited by long haulers suggest the presence of different underlying mechanisms that actually cause post-COVID-19 syndrome. So from an anti-aging, personalized precision medicine approach, some of the therapies that we're going to look at will deal with all of these symptoms. So we're going to look at gut health testing. Is it important to know what's going on with the gut? Absolutely. Is it important to know what's going on with the adrenals? Certainly. So we're going to look at salivary testing. It's important to look at complete thyroid studies. TSH, free T3, free T4, reverse T3, and thyroid antibodies. We should look at ferritin because some people do end up with an elevated ferritin level. Melatonin is involved in all of this. Vitamin D. When we look at treatment, low-dose naltrexone is very important. Some great studies on iodine nasal spray. Most people who have COVID long haul, there is mitochondrial dysfunction. We're going to examine that. We're going to look at zinc, B complex, quercetin, and glutathione. So let's begin by looking at melatonin. Certainly, these are the functions of melatonin. It's not just a sleeping hormone. It aids in the immune system. It's a great antioxidant. It does block estrogen from binding to receptor sites so that people can have estrogen available for the body to use. It lowers blood pressure, protects against reflux, decreases inflammation. It really builds the immune system, and it has all these very positive effects in the body. So the combination of the anti-inflammatory and antioxidative properties of melatonin offers a possible therapy for not just COVID itself, but for COVID long haul, because it affects all stages of life cycle, the cell entry, the viral replication, and the deleterious downstream signaling cascades that can occur. So when you look at the antiviral action of melatonin, it decreases ACE2 surface expression, decreases viral protein application through the inhibition of chymotrypsin-like protease, which decreases viral replication. It has all of these antioxidant effects. So it scavenges oxygen. It increases SOD, glutathione, increases catalase, which decreases reactive oxygen species. In fact, melatonin counteracts ROS damage by stabilizing the inner mitochondrial membrane. And it also activates the electron transport chain to improve mitochondrial respiration, ATP production, and ultimately reducing electron leakage and reactive oxygen species generation. These are the anti-inflammatory effects of melatonin. We always talk about melatonin being for sleep, but look at all this. Is there anything that you can think of that has all of these anti-inflammatory effects that melatonin has? Decreases NF-kappa signaling, decreases angiotensin 2, binds SARS-CoV-2 to the ACE2, and it increases SIRT1 activity, which decreases macrophage activity. And the combined effects of increased angiotensin 2 and decreased effects of angiotensin 1 through 7 result in the breakdown of lung cells. So you get a pro-inflammatory response, and you can see what happens when a lot of people have a cytokine storm that occurs. Melatonin, again, is an effective inhibitor of angiotensin 2 activation and facilitates angiotensin 1 through 7 action. In addition, SARS-CoV-2 causes severe lung pathology by inducing bronchiolitis, which is a highly inflammatory condition. So it triggers an innate immune system receptor known as inflammasome, and it causes inflammation. And this inflammatory process continues and is part of not just COVID itself, but really increasing the risk of COVID long haul. So a viral protein created by SARS-CoV-2 directly interacts with inflammasome NLR family pyrin domain containing 3. And the activation of NLR or NLPR3 induces pro-inflammatory cytokines like interleukin 1B and interleukin 18. Melatonin acts as an inhibitor of this inflammasome. Also, when you look at SARS-CoV infection, it does involve cytokine storm. And all of these things, TNF-alpha, C-reactive protein, interleukin 1B, interleukin 6, interleukin 17, they're upregulated and increase the activation of neutrophils, macrophages, and mast cells. So when mast cells get increased, it almost becomes a pseudo-inflammatory response. It's almost like an allergy. I mean, you start getting these interesting responses. And melatonin has been shown to inhibit NF-kappa beta signaling. It downregulates inducible nitric oxide synthase and COX-2 and inhibits TLR4 activation. So these are symptoms of cytokine storm that you can see in patients. And honestly, my patients have had every single one of these, including a patient who had a seizure from COVID. Specifically, there's a hyperinflammatory monocytes and macrophages that occur that gather in the respiratory tract during this infection. And you end up with this hyperinflammatory state that if you don't do something about the inflammation, will continue on. And some people believe is part of the reason people do get COVID long haul. Moreover, melatonin exerts its antioxidant properties through direct scavenging of oxygen and nitrogen-based free radicals. It also suppresses pro-oxidant enzymes, maintains mitochondrial homeostasis, stimulates antioxidant enzymes like SOD, glutathione, and catalase. Melatonin has a lot to do with the immune system. Again, it's not just a hormone for sleep. This preclinical data suggests that melatonin may inhibit COVID-19 progression. So in looking at this, we should look at melatonin for everyone. And the doses of melatonin have been really varied in studies. Most people, usually if someone has severe melatonin and cytokine, or severe COVID and cytokine storm, then they start with 20 milligrams of melatonin. Some studies go up to 50 milligrams of melatonin. But remember, it's all about balance. So if you give too much melatonin for the patient, serotonin goes down. So we do want to measure melatonin by salivary testing to make sure the patient has the right amount for them, because that is the kind of medicine all of us do. We look at the cause of the problem and not just treat symptoms. It is a very personalized approach for every patient. And one of the most prominent effects of melatonin is on the red blood cells. It has a significant modification of their lipids that disturbs both the diffusion of gases and the red blood cells as well, including the capillary bed. So without the use of melatonin, the patient will commonly develop B12 deficiency if it's not already present to begin with. So the study actually examined that and its relationship with reactive oxygen species. This pathophysiological association supports using melatonin, both prophylactically and as therapy of COVID-19 and COVID long haul. Great safety profile. This study suggests that melatonin is a potential and promising agent to overcome COVID-19 and boost the immune system, particularly in people who are obese and people that are diabetic. So you can see there's a lot of studies when it comes to melatonin. Here, the study concluded the use of melatonin, which is reduced in the elderly and immunocompromised patients, should be considered as an adjunct therapy. And this author suggests that melatonin may immediately be able to prevent the development of severe symptoms. And if you actually start melatonin during the disease, then it may prevent COVID long haul. More to come on that subject. When we look at melatonin sleep in the immune system, individuals have reduced sleep, the formation of inflammatory cytokines. And trials have revealed the person slept 4 hours a night. It reduced their natural killer cell activity by 72%. So the perfect amount of sleep people should get is 6.5 hours to 8 hours. I have very normal melatonin, and I'm one of these people that honestly, I don't have any trouble sleeping at all, but I had to change because when all these studies started coming out, I was always a 5-hour sleeper. That is not enough to have your immune system good. So I really do sleep 6.5 hours now. It's not just about power sleeping. These are signs and symptoms of melatonin deficiency: insomnia, fatigue, anxiety, early morning awakening, interrupted sleep, stress, increased risk of developing cancer, particularly breast, seasonal affective disorders, immunological disorders, heart disease, and of course, what we're talking about today, a compromised immune system. Etiologies of low melatonin: eating too many high glycemic index foods, excessive intake of alcohol, caffeine abuse, tobacco, electromagnetic fields, the aging process itself, vitamin B12 deficiency, the medications listed here. Wow, a lot of people have low melatonin because there's so many causes of it. So melatonin is used to prevent and treat all of these things. There's great clinical trials on all of them, including COVID-19 and COVID long haul. Two double-blind randomized clinical trials use melatonin, doses of 5 milligrams twice a day, oral capsule for 7 days, 5 milligrams per kilo of body weight IV was used in an ICU setting. So it's been used in people who are very ill as well. And here you can get on and look at the clinical trials that are still going on. The CDC identifies patients with the following conditions as the most risk for severe cases of COVID and then COVID long haul: people with cancer, chronic kidney disease, COPD, heart conditions that are listed here, obesity, pregnancy, sickle cell, type 2 diabetes, a history of smoking, and a history of solid organ transplantation. And the authors of this study recommend that melatonin be given to everybody at 2.5 to 10 milligrams at night if they are diagnosed with COVID-2, which may literally prevent COVID long haul, and it does help with morbidity and mortality. Now, you can't get too much, and that's why we measure. These are symptoms and signs of elevated melatonin. It's not just decreasing serotonin. It can cause all these other things as well, including increasing cortisol. These are possible side effects. It is an immune stimulator. Do keep that in mind. So people that are pregnant, breastfeeding, etc., you have to take that into account. Moreover, caution should be exerted in patients on multiple medications because it does inhibit patients that take medication that inhibit the cytochrome P450 system. Melatonin is metabolized through that pathway in the body. Finally, reports highlight that melatonin can be an adjunct to enhance the effectiveness of COVID vaccines. Wow, a lot to say about melatonin, but it is a fabulous, fabulous hormone to build the immune system. And then, of course, vitamin D is actually really not a vitamin. It is a pro-hormone. So authors of this study propose there's no downside to increasing vitamin D intake and having sensible sunlight exposure to maintain vitamin D. And really, we've always said for people 55 to 80 was the optimal amount, minimizing the risk of COVID-19 infection and its severity and COVID long haul. It's really important to have vitamin D where it belongs. Vitamin D is considered immunomodulatory. It regulates both the innate and adaptive immune system. For the geeks in the crowd, these are the different mechanisms that you can go through on your own and really review how vitamin D works. Factors known to be associated with increased susceptibility to severe outcomes from contracting COVID-19 are age, cancer, immunocompromised state, chronic kidney disease, respiratory disease, cardiometabolic disorders, and smoking. The elderly, people who are African Americans, patients with obesity, nursing home residents, all have higher rates of infection, morbidity, and mortality. Something very useful we can do is help them have enough vitamin D. Everybody that I just mentioned, almost all of them are actually deficient. And there are some references. The results of these studies suggest an association between the prevalence of vitamin D deficiency and the risk of being infected with COVID-19, dying of it, severity of disease, and whether the patient gets COVID long haul. So we should measure vitamin D status. Vitamin D3 supplementation is what is recommended. And in that study, people did better who are on optimal levels of vitamin D. Now, to reduce the risk of infection, they are suggesting that people consider 10,000 international units of vitamin D3 for a few weeks if you are exposed. From an anti-aging personalized medicine approach, we have always looked at measuring vitamin D, but there are a few people that cannot be therapeutic. Again, from Grant's work, Garland's work, and Vasquez's work, perfect vitamin D is 55 to 80. However, people with granulomatous diseases, like sarcoid and Crohn's, people with hyperparathyroidism, and people with active cancer, because calcium may elevate, we may not be able to get them therapeutic. Vitamin D may increase the antiviral activity of the bronchial cells, and some great studies at looking at calcitriol, which can be synthesized in the lung cells to really help with people to decrease inflammation. So it's really an antibacterial effect that it has. So when you look at calcitriol for patients with chronic kidney disease, there is an inverse association between the mean daily calcitriol dose and COVID-19 severity, mortality, and now the newest studies are showing there is a relationship with COVID long haul itself. So does it matter if we look at melatonin? It does. Does it matter if we look at vitamin D? It does. Probably the world's best anti-inflammatory agent. Boy, I do love fish oil. I love curcumin-turmeric, but my favorite is low-dose naltrexone. LDN is absolutely a fabulous anti-inflammatory agent. We've always used it for autoimmune diseases to prevent memory loss, treat memory loss. We use it for anything inflammatory like diabetes and heart disease. We could go on and on. COVID-19 is an autoimmune disease process. So looking at the use of low-dose naltrexone to decrease inflammation is really important. Are there studies showing this? Yes. Coronavirus 2019, they looked at COVID. The risk of severe acute respiratory syndrome poses a particular risk to people who had an inflammatory response to begin with. So if they already have hyperinflammation, then of course they're going to be sicker. They have more of a chance of having COVID long haul as well. This is a very important article here that points out the critical point that the progression of COVID-19 ensues. It appears to center on the loss of immune regulation between protective and altered responses due to the exacerbation of the inflammatory components. So people that are inflamed to begin with get worse COVID by and large. People that are inflamed to begin with and from COVID do go on to have more of a risk of having COVID long haul. The early stages of the process, free radicals exert their action on NF-kappa beta and AP1. Then you get a synthesis of cytokines and cytokine storm. So here's a lot of reasons people become inflamed. Honestly, almost every disease you get after the age of 42 is inflammatory in nature, but infection is certainly one of those. You also notice that there's other things that sometimes we don't think about. Stress is on this as well. So in recent years, there's novel and significant findings on the off-label, quote unquote, use of naltrexone. Obviously, regular naltrexone and regular dose of 150 milligrams is used for a drug overdose. In baby doses or low-dose naltrexone, it is an immune modulator. It has anti-inflammatory effects. It does help with chronic pain control, weight loss, and reduction of cytokine storm. So you can see how LDN would be great for people. Honestly, almost all my patients that end up with COVID, I put on LDN if they're not already on it, at least 1 milligram. So I've had less people in my personal practice go on to COVID long haul than what the national studies show. These are potential side effects of low-dose naltrexone. Insomnia is the most common. Fortunately, it usually only happens for the first night, and that's in about 30% of people. People can have vivid dreams, fatigue, loss of appetite, nausea, hair thinning, mood swings, and mild disorientation. These are commonly dose-related. Potential long-term side effects, possible kidney and liver toxicity. So far, I haven't seen that. Possible tolerance to the beneficial rebound effect. We are starting to see a little bit of this. So there's a big discussion now in the medical literature, and I serve on the board of the LDN Trust. We're discussing whether people should actually take a holiday of low-dose naltrexone. If you're on 1 milligram like I am to help prevent breast cancer, then you probably don't need a hormonal, meaning LD on holiday. However, if the patient's on 4.5 milligrams, they may end up with a potential rebound effect. We are currently recommending that people take 2 days a month off if they're on 3 milligrams or more of long-term low-dose naltrexone. Other unknown sequelae is always listed. Been using LDN in my practice for 10 years. So far, I haven't seen that. Counterindications are acute hepatitis, liver failure, recurrent or current opioid use, and alcohol abuse. And then this is the most common protocol that is used. For all diseases, we change the doses every week. However, with post-COVID-19 and severe COVID infection, we have discovered that giving 1.5 milligrams at night, or really any time of day, for 5 days, and then you change the dose 5 days later instead of a week, so that they're on 2, 3 milligrams, then they're on 3, so 4.5 milligrams. Change the doses every 5 days is probably what we need to do for an infection with people who have COVID to try and prevent COVID long haul and its inflammatory process. Patients should not have their inflammatory markers measured within a month of having a vaccine, by the way, because the patient may become ill after having their immunization. They get a mild form of the disease. A small amount of inflammation heals. Do not forget that. However, too much inflammation does cause disease. The next thing that we do with patients with either COVID or COVID long haul is we look at iodine. Iodine kills almost everything that there is. And iodine nasal spray has some great studies. This randomized clinical trial investigates the efficacy of nasopharyngeal povidone iodine solution in reducing viral load of patients with COVID-19. And here it inactivated the coronavirus. And so it is used for SARS. It is now has some great studies on other infections as well that are viral. So in this study, the formulations tested may help to reduce the transmission. It's used for nasal decontamination, oral decontamination. So iodine nasal spray is something we now use prophylactically. Tomorrow morning, I'm going to be getting in a plane, so I will use iodine nasal spray before I get in the plane or immediately afterwards because there's so many people that are infected. I used it at my daughter's wedding that was just this last weekend, so we can use iodine nasal spray prophylactically. So during COVID long haul, and as prophylaxis as well. If you're not familiar with iodine nasal spray, the major company that makes that is in Detroit, where I practice. They did the actual research. The first study was done in Israel. The other studies were done at the University of Nebraska, but this product is actually made in Detroit. Now, you're always welcome to email me if you want more information. And this study proposes the use of 0.5% in healthcare workers to help prevent the disease. And then this trial concluded that iodine nasal spray effective for the prevention, treatment of COVID long haul in healthcare workers and in others as well. Now, you can overdose on iodine. Okay, you can get symptoms, so it's really not for everyday use for the rest of your life. And so, again, we can measure levels of iodine as well. Yes, COVID and COVID long haul is associated with mitochondrial dysfunction. So the engines in the body are not working well. And you can see the different things that can occur. Are there studies showing this? Absolutely. One rationale concerning adult onset mitochondrial disorders becomes more common is that may be related to thyroid and adrenal dysfunction. So they're starting to wonder about all of this. When it comes to mitochondrial disease, it affects children. It affects adults as well. An important part of the first immune response is the activation of neutrophils results in the production of reactive oxygen species. However, when ROS release is excessive due to excessive stimulation of neutrophil activity, the result is often physiological damage, and you end up with literal mitochondrial poisoning. You end up with oxidative phosphorylation uncoupling and lipid peroxidation, none of which are a healthy state and all cause mitochondrial dysfunction. So I kind of equate it, being from Detroit, to a car. So it's kind of like having a really fabulous car and you put low octane fuel in it. What happens if you put low octane fuel in a Corvette? Well, it knocks, breaks down, and dies early. The body does the same thing if it has mitochondrial dysfunction. And these are four major components of mitochondrial dysfunction: reduced ATP production, increased free radical production leading to oxidative stress, increase in altered free radical production, leading to abnormalities in ROS signaling that lead to disease phenotype, errors in glucose metabolization, neuroinflammation, antiviral defense, etc., and altered metabolite utilization, which favors oncogenesis and tumor growth. So that last one is a little disconcerting. We don't want to leave these people with mitochondrial dysfunction. Impaired mitochondrial function is also associated with defects in mitochondrial performance. And you can go through all these on your leisure and see what happens. So you even get decreased number of mitochondria as well. Symptoms of mitochondrial disease depend on which cells of the body are affected. So the patient can have mild, moderate, or severe disease. Also depends on the age of the patient. So these are symptoms of mitochondrial illness, any of them, and that includes COVID long haul, abnormal growth pattern, movement disorders, muscle weakness and pain, decreased muscle tone, inability to tolerate exercise, vision problems, decreased hearing, learning disabilities, developmental delays, mental retardation or cognitive decline, heart disease, liver disease, renal disease, GI disorders, insulin resistance and diabetes, autism, increased risk of infection, seizure, stroke, hypothyroidism, respiratory problems, lactic acidosis, and again, cognitive decline, which can literally lead to dementia. But that's what happens when the engines in the body do not work effectively. And that commonly happens with both COVID and COVID long haul. So this is my personal cocktail for improving mitochondrial health. You're certainly welcome to borrow this. So magnesium glycinate or threonate, 400 to 600 milligrams, CoQ10 and alpha-lipoic acid, 300 to 400 milligrams, D-ribose, 5 grams 3 times a day, NADH or NAD plus 10 milligrams BID, and L-carnitine 2,000 milligrams if the patient has normal renal function. But that one you do have to measure TMAO levels before you can give L-carnitine. Otherwise, there's an increased risk in heart disease. So if you look at magnesium itself, this study hypothesizes the low magnesium levels may advance a transition from mild to critical clinical studies. There's a study now ongoing on that low magnesium may be one of the causes of COVID long haul. So you do want to look at measuring an RBC magnesium. And these are the possible mechanisms by which magnesium can reduce inflammation, oxidative stress, and bronchial smooth muscle relaxation. This cohort study showed that combined oral treatment of magnesium, vitamin D, and B12 reduced the proportion of older COVID-19 patients that had clinical deterioration. Less people ended up in the ICU, and we're now seeing less people are getting COVID long haul if we're actually treating people early. In this study, magnesium sulfate extended infusion is suggested as an adjunct treatment for critically ill patients. And this study suggests that administering magnesium, that we really want to make sure that you look at what's going on with the renal system because it is cleared through the kidneys. How about coenzyme Q10? In this prospective study, COVID-19 was really a problem when it came to CoQ10. So giving CoQ10 increased energy, immune system, decreased oxidative stress, and help prevent COVID long haul in some patients. The authors of this study considered looking at COVID long haul from the viewpoint and COVID of coenzyme Q10, along with other things like TMZ. In this study, both reagents show promise in the treatment of patients. So COVID coenzyme Q10, again, very important, as is alpha-lipoic acid. Authors concluded in this study that it's a promising candidate. You can't really eat your way into alpha-lipoic acid. So when you end up using alpha-lipoic acid, not only does it help regulate blood sugar, but it helps with the distribution and versatile antioxidant properties. It interferes with several signaling pathways that are problematic. It improves endothelial function, restores endothelial nitric oxide synthase, and it has an anti-inflammatory and antioxidant effect. The authors here concluded the safety of using lipoic acid. This study used a very high dose of ALA. Now, you do need to be aware that from Bert Bergson's work, that at 600 milligrams and above of alpha-lipoic acid may negatively impact the conversion of T4 to T3. If you're using it short-term, up to a week, that's not an issue. But if you're going to use those big doses like 600 milligrams BID, then you do need to go back and look at thyroid functions. And have I seen this happen in patients? I have, when I was treating hepatitis C with high-dose alpha-lipoic acid. Another beneficial effect of alpha-lipoic acid depended on its antioxidant and anti-inflammatory effects. So it actually decreases C-reactive protein, interleukin-6, and TNF-alpha. This analysis reviewed the emerging literature on the potential of using lipoic acid in other viral infections as well. D-ribose. Individuals took supplemental D-ribose. It can bypass part of the pentose pathway to produce D-ribose phosphate for more energy. NADH does help with DNA damage caused by oxidative stress. And then here are studies on L-carnitine, a strong antioxidant and anti-inflammatory. And this study suggests that L-carnitine may have beneficial effects in mitigating SARS-CoV-2 infection, and long-term use may help with SARS-CoV long haul. In addition, compromised populations are prone to having chronic inflammation. This is mitigated in this study by L-carnitine. Same thing with this trial as well. And here, the patient's going to take L-carnitine long-term. Here are studies showing that you do have to measure TMAO levels. There's really only two reasons for an elevated TMAO: poor gut health or inheritance. So if it's a gut issue, go back and fix the gut, do a gut health test and fix the gut. If it is hereditary, then people cannot have L-carnitine as a supplement. They cannot have choline as a supplement. They cannot eat eggs or red meat. Zinc. Well, when it comes to the immune system, it wouldn't be a seminar on what happens with the immune system without discussing zinc. In the interim, assessing zinc status of people with chronic diseases and older adults as part of COVID long haul and COVID, there's a higher risk of zinc deficiency than people do have a poorer outcome. People who are older are more prone to zinc deficiencies. And remember, when you give zinc, you do have to balance with copper. So it's 10 to 15 milligrams of zinc with 1 milligram of copper. When it comes to B vitamins, you can have all of these different issues. B vitamins are really, really important. Supplementing with B complex twice a day should be considered in people with COVID and post-COVID long haul. I'm actually doing this with everybody because vitamin B assists in proper activation of both the innate and adaptive immune responses, reduces pro-inflammatory cytokine levels, improves respiratory function, maintains endothelial integrity, prevents hypercoagulability, and it does reduce the length of stay in the hospital. So do not forget B vitamins. They are water soluble, so they do have to be given twice a day. And again, vitamin D deficiency can significantly impair the cell and immune system and lead to more inflammation and, of course, high homocysteine levels. So you can go through each of the B vitamins. Have they in the medical literature? They have. Vitamin deficiency affects the cardiovascular system, causes neuroinflammation, increases inflammation in general. And this article suggests that high doses of thiamine given to people at early stages of COVID helps limit hypoxia, decreases hospitalization, and an ongoing study now suggests that it may actually prevent COVID long haul. Riboflavin, UV light, were shown to decrease the infectious titer of SARS-CoV-2 below the limit of detection in human blood. And when it comes to vitamin B3, it's a coenzyme derived from niacin. It's released during the early stages of inflammation and the immunomodulatory effect. When you look at nicotinamide and niacin, it decreases pro-inflammatory cytokines like interleukin-1B, interleukin-6, and TNF-alpha. So this study suggests that targeting interleukin-6 may help control the inflammatory storm of cytokines that occur in people with COVID-19. And here, there's lung protection and immune strengthening to try and help prevent and treat COVID long haul. B5, there's limited studies, but they are starting to look in this as well because pantothenic acid has to do with the immune system. And then vitamin B6, the activated form, has an inverse relationship with plasma interleukin-6 and TNF-alpha in chronic inflammatory conditions. And COVID long haul is an inflammatory condition. During inflammation, the utilization of pyridoxal 5-phosphate increases results in the depletion, suggests that COVID-19 patients with high inflammation do have a deficiency. And here, two different studies, dysregulation of immune responses and increased risk of having coagulation problems have been noted in people with COVID-19. In this preprint, it suggested that pyridoxal 5-phosphate supplementation does mitigate the cytokine storm that occurs and helps prevent hypercoagulability. And we're now starting to see some hypercoagulability, not when people had COVID-19, but when they actually have COVID long haul later on. In fact, in this next study, 3 decades ago, pyridoxal 5-phosphate levels reduced abnormalities in platelet aggregation and blood clot formation. So we have known this for a long period of time. Researchers at Victoria University reported that B6 upregulated interleukin-10, a very powerful anti-inflammatory immunosuppressive cytokine. So looking at pyridoxal 5-phosphate to decrease cytokine storm during COVID, and it may occur in COVID long haul as well, is important. Vitamin B9, it was suggested that folic acid could be beneficial for the management of the respiratory disease early. We're now discovering that some people with COVID long haul are having methylation issues. Did they have them before? In all honesty, in most patients, we don't know, because unless it's people like all of you or myself, people really don't look at methylation testing, but we should be. We should be looking at measuring estrogen metabolization. We should be looking at homocysteine and doing an actual methylation test itself, because 50% of people in the world are poor methylators. And a recent preprint report here showed that methylated folic acid may be used as a therapeutic approach for the management of COVID-19. What I can tell you is that my own personal patients that are normal methylators, most of them had very mild COVID. Vitamin B12 acts as a modulator of gut microbiota, and low levels of B12 elevate methylmalonic acid, homocysteine, result in increased inflammation, ROS, and oxidative stress. So we can't say enough about B12 as well. And we do know that SARS-CoV-2 interferes with B12 metabolization, and it impairs intestinal microbial proliferation. So if 70% of the immune system's in the gut, you can see why 50 to 80% of people go on to have COVID long haul. These authors suggest that since symptoms of vitamin B12 deficiency are close to the same symptoms of COVID-19 and COVID long haul, oxidative stress, lactic dehydrogenase changes, hyperhomocystinemia, positive coagulation issues, renal and pulmonary and vasoconstriction issues, you need to look at what's going on in B12 in all of these patients. And these articles advocate that B12 therapy can be beneficial with people with COVID. And now studies are just starting to come out now on treatment of COVID long haul with B vitamins. Clinical study conducted in Singapore showed that COVID-19 patients who were given B12 and vitamin D and magnesium reduced COVID severity, and it also increased the person's risk of not having COVID long haul. This study showed that methylcobalamin had the potential to reduce any organ damage that could occur. How about quercetin? I've been taking quercetin forever because I really have high mast cells. So again, we want to look at what happens with quercetin. It does suppress the NLRP3 inflammasome. It affects the regulation. So this study suggests the use of quercetin as an anti-inflammatory, antioxidant, analgesic, and really helping with inflammation in people with COVID and COVID long haul. And examining the clinical COVID-19 manifestations, multifaceted use of quercetin because it's anti-inflammatory, it decreases thrombin inhibitory actions. It should be taken into consideration to start the patient on quercetin as well. This is a summary of the molecular mechanism and actions of quercetin to manage COVID-19 and COVID-19 long haul. So you can see that all these pathways are positively affected, even the gut microbiome, because quercetin decreases dysbiosis. These studies state that high absorption sources of quercetin, excuse me, they have potential for boosting the type 1 interferon response, reducing viral infection risk as well. And the dosage in these trials was 1,000 milligrams a day. In this study, authors suggested the current evidence for the use of vitamin C and quercetin together as prophylaxis was also beneficial for the patient. How about glutathione? Well, certainly glutathione, we all know what it is. It increases the production of the enzyme necessary to synthesize glutathione, is really important. The patient supplements with curcumin or quercetin. Glutathione is counterindicated in people who have sulfite sensitivities. Do not forget that. It is essential for the control of endogenous vitamin D biosynthesis. And it's a strong antioxidant, antiviral, anti-inflammatory, anticoagulant agent. So if you do an actual methylation test, it goes down into transsulfuration, and you can see on one side would be whether the patient had normal glutathione levels or not. There's other testing that you can look at that too suggest whether the patient has glutathione. Yes, you can eat your way into more glutathione. We don't talk about this very often, but I thought I would put it on the slide for everybody. So all these foods increase it. Some of my personal favorites are on here, okra and avocados. These authors suggest the severity of clinical manifestations in COVID-19 patients may be determined by the degree of impaired redox homeostasis attributable to the deficiency of reduced glutathione and increased reactive oxygen species. So, and its production. I can't say enough about glutathione because people with severe COVID-19 tend to have low levels of glutathione. We are now looking at COVID long haul, and people who have COVID long haul do tend to have lower levels of glutathione. So these are etiologies of glutathione deficiency, more common in males: cigarette smoking, chronic disease, people who don't eat fruits and vegetables, the aging process, usually starting at about 65, acetaminophen use, of course, toxic metals, alcohol abuse, foods that have a lot of nitrates and nitrites, and chronic diseases like type 2 diabetes, obesity, heart disease, respiratory diseases, cancer, liver disease, and they have now added to this COVID-19 and COVID-19 long haul. So activation of NF-kappa beta has been shown to be required for transcription of the genes for many of the pro-inflammatory mediators, and this study looks at oral and IV glutathione, absolutely important to help address cytokine storm and help prevent further disease. In multiple studies, elevated expression of interleukin-6 can be used to predict the severity of COVID-19 and also whether the patient now is going to get COVID long haul. Glutathione supplementation has been shown to be beneficial. When I got COVID, I did go to the office and have IV glutathione done, and I do take glutathione every day. It really does help. And these studies, pneumonia or dyspnea, really occurred with glutathione supplementation. The patients did better because it lowered their inflammatory response of interleukin-6. And of course, this wouldn't be a talk about any disease process that was related to infection without talking about what happens with the gut. So does it matter if people are on probiotics? Of course it does. Are there studies showing this? Yes. So analysis of the pathways of SARS-CoV-2, the GI tract is involved, leading to inflammation of the mucosa. It's shown that individuals with COVID-19 and GI symptoms have a longer time from onset to remission, and GI symptoms usually become more pronounced as the disease progresses, and people who have an unhealthy gut commonly more go on to COVID long haul. In this study, patients with intestinal dysbiosis had decreased lactobacilli and bifidobacterium who ended up having problems with COVID. This pilot study of 15 people in Hong Kong showed the same thing. And the role of probiotics in preventing viral respiratory infections in general has a lot to do with whether the gut is healthy or not. So probiotic formulation administered to people with COVID-19, they got better faster, they had less symptoms, and they went on to have less COVID long haul. There is a gut-lung axis. The authors of this study concluded, since the mucous membranes from the respiratory tract and GI tract are affected, in addition to dysbiosis and inflammation, it's possible to assume that adjunctive therapies based on the modulation of the gut microbiota really need to be done. Because if you're not fixing the gut, those people more commonly do go on to have COVID long haul. It's been shown that vaccine efficacy against viral respiratory infection is influenced by probiotics. So even if the patient gets a vaccine, whether it works better or not has to do with a healthy gut. So in summary, and then we're going to take questions, the good news is there's a lot of research coming out on all of this. And most diseases, it's not just about one therapy. To prevent and help prevent COVID, to treat COVID, and to treat COVID long haul, it does matter if the immune system is intact. It does matter if the GI tract is intact. It does matter if the patient decreases inflammation. It does matter if they have enough vitamin D. In fact, we could go on and talk about male and female hormones as well, because they're part of the immune system also. A lot of research now, fortunately, is really coming along with all of this so that we now can have a better idea of what we can do to help patients prevent and treat COVID long haul. Thank you very much.